At Orthodontist Associates, in our mission and vision statement, we talk about emphasizing the importance of early screening and treatment, managing dental facial development towards a good goal and objective where once all of the permanent teeth have erupted, you can achieve a nice skeletal and dental relationship. Sometimes this early treatment is referred to as appropriate early treatment, but it's also referred to as phase 1 orthodontics. I always tell my patients phase 1 is anything we're doing early, typically in the mixed dentition, but there's also times when we're treating the primary dentition to manage dental facial development towards a good goal and objective, and it may include partial braces. You can't consider a full set of braces in the mixed dentition, but you may consider alignment of anterior teeth as part of a phase 1 treatment plan. You're also may, as part of a phase 1 or early treatment orthodontic plan, you might be treating some of the contributing factors that to poor dental facial development that we talk about. Phase 2 orthodontic treatment is not until we have all the permanent teeth. Typically, you can think of phase 2 orthodontics as a full set of braces, and it usually follows phase 1 orthodontic treatment. And typically, phase 2 treatment is what's going to put the detail into your malocclusion, or typically phase 2 treatment is what's going to put the detail into your bite. Okay, so sometimes we start phase 1 treatment and we can reach our goals and objectives, and patients will end up in a phase 1 or an early treatment retention phase, and then we evaluate for phase 2 orthodontic treatment at a later date. And we typically don't do that until all the permanent teeth have erupted. So as part of phase 1, we're always watching dental development until all of the permanent teeth erupt. And then we determine whether or not we have a stable or a functional relationship. We're not going to look at a phase 1 result after all of the permanent teeth come in and say, does it look good or bad? We're going to look at it and say, is this most stable or most functional? And if we can say that, whether or not we do any phase 2 orthodontics may be irrelevant to a patient's dental health. If we think we can improve upon it, we're going to recommend a full set of braces to detail. So sometimes we're treating kids at 6, 7, and 8. We're resting in phase 1 retention from 8 to 10, 11 years old. Once all the permanent teeth are there, we might recommend a phase 2 orthodontic treatment plan, and then we're typically finishing. But again, one of the goals and the objective of phase 1 is, I'm always telling patients and parents, when the last baby tooth falls out and the last permanent one comes in, I'd rather be closer to the goal and the objective. And there's much that we can do early that can head us in that direction. And by and large, a lot of these kids that go through 2 phases of orthodontics are finishing before high school, 6th, 7th, and 8th grade. All of their permanent teeth are in and they're done. And if you can get this done before high school, we think that's an advantage. There's a lot of good reasons that we recommend 2-phase orthodontics. Sometimes you're coming to see the orthodontist over a longer period of time, but by and large, we finish with nicer looking results. We believe we're finishing with more stable orthodontic results because we're treating those contributing factors at a young age, and we're finishing, we believe, with nicer looking results. So we believe 2-phase orthodontics is very, very important, and if a child is on a bad path of dental facial development, typically we're not recommending that child's treatment be delayed. We don't subscribe to the philosophy of waiting till a patient is older and has all of their permanent teeth. Again, from a historical perspective, we were all trained as orthodontists to wait until the kids were older. To me, it's a reactive approach to orthodontic treatment or orthodontic care, and instead of being reactive, we subscribe to phase 1, phase 2 orthodontic treatment, where we're more proactive and preventative.